Today, we're going to talk about fat transfer of the face. Fat transfer of the face is used to treat the aging face. There are two things that happen with an aging face. One is we lose volume in the compartments of fat. We lose volume in the fat compartments in the face. And the second is we have a descent of the fat pads of the face. Now, when we look at her before picture, her eyes look hollow because of the descent of the cheek. Now, when we look at the lateral side of the face, we have a straight line because she's lost the fat pads, the fat volume in the cheeks. So there's been a descent and a loss of volume. So now we've done a fat transfer to the face. This is our before and this is our after. The after face just looks more youthful. Now, what I did was liposuction her abdomen and harvest the fat from the abdomen and inject in the face. So now we injected the temporal area because we got temporal hollows. We injected the lower lid, the cheeks, the nasolabial fold, the marionette line, and the lips. So what we've actually done is fill in this compartment. Now, when you look at the line of the face here, it's more of a straight line. The face is very thin. Now we have a full round face. A round face is the face of youth, the look of youth. A hollow face is a face of aging. Now, after we did the fat transfer to the lower lids, the lower lid is smooth. There's not such a long level of the lower lid. Now we see the smooth cheek. We see the cheek protruding, whereas the face is flat. We see the temple area fuller. We can just see the lips are better. The nasolabial fold is better. This face is just a younger face than it was before. So this is the real great part of the fat transfer of the face. The thing is, it gives a natural look. It doesn't give a surgical look, gives a natural look. I think the fat transfer of the face should even be a part of facelifts at this point. The other thing about fat transfer of the face is that the fat lives forever. Once it lives and gets a blood supply, it lives forever. So other than fillers that you have to replace every 6 months to a year, the fat is going to be there and give a permanent change. The last thing that's really good about the fat transfer of the face is you can look at the skin texture. When you talk about the vampire facelift, we're talking about adding stem cells from the blood. Fat has many more stem cells than the blood, so now we get improvement in the skin texture from the stem cells from the fat. This is the same thing when they started to do stem cell injections in the knees to build cartilage. We're doing the stem cells in the face to give better skin tone, thicker skin, a more youthful appearance. Now, this full round face is a youthful face as opposed to this hollow, thin face. I think the fat transfer face is very important, and I kind of think it challenges a facelift. I think in some cases, it gives a better look than a facelift. And even if you do a facelift, you should be thinking about doing some fat transfer along with it to really fill out the compartments and give this look of youth. So this is the before and after fat transfer of the face. Again, this is a permanent result. And I think fat transfer of the face is a beautiful thing and may even replace a facelift.